Hello, my name is Brucha Weisberger. I have no financial conflicts of interest. I want to start by reminding all that God is listening to every word said here, knows the thoughts of every being, and is all-powerful. He will repay each in kind. Baruch Shachom Liyad B'Dvaro, Ein Oz Melovato. He is the only power. Lamnatzech Al-Muslabein, this knowledge of it. God has entrusted you, the FDA, with the enormous responsibility to safeguard the lives of Americans. We trusted you implicitly for decades, but now you broke the trust. As tens of thousands died from the COVID injections, you've taken no action. Murder by poison shot is the same as murder by gunshot. God and the world will judge you, so I urge you to have the courage to stand for the truth that you know as well as I do, and not allow pressure, financial incentives, or threats to influence you. Perhaps it is for your life-saving vote today that you were born. You're being asked to vote on whether millions of babies and children will be receiving the COVID shots. But before injecting anything into a human being, a rational person will ask three questions. Is it necessary? Does it work? And is it totally safe? The first rule being, do no harm. Let us examine these
Excuse me, Brucha? Brucha, we're just going to interrupt you. I'll give you the time back, but can you please tell us which slide you're on so we can make sure we move your slides along?
Slide 1, and I'm going to tell you when to move it. Thank you.
Okay, thank you.
Let's examine these three questions. First, do children need these shots to prevent dangerous illness? Definitely not. Children's very active thymus glands and lack of ACE2 receptors results in a very low viral load. Children rarely get very ill with COVID, and they simply do not die of COVID. You're aware that the CDC drastically exaggerated COVID morbidity and mortality, especially in the pediatric population, to hype up the fear, which is what we just heard in the comments of the two parents now. Also, there is treatment for COVID that is effective, but it has been suppressed in order to hype up the fear. Actual data shows that hospitalizations are usually for other reasons, and the child just happened to test positive. Slide 3, please. The fatality rate for the 5 to 11-year-old kids could not even be calculated due to an absence of cases. Slide 4, please. It turns out that 100% of so-called COVID deaths in children were in kids with a pre-existing condition. The truth here is that these children died of their pre-existing condition and not of COVID. Most children have already been exposed and developed immunity, making a vaccine even more redundant and even more dangerous to them. Will you explain to the world then what is your rationale for giving this shot to kids? Second question, do the shots even work? Slide 5, please. Fraudulent claims of efficacy are being made based on antibody levels. That's the immunobursting that was being referred to. It is not a true marker of immunity. Pfizer's initial trial failed to show any benefit to children, and efficacy for kids plummeted to 12% within a month. Slide 8, please. Here is Uruguay, where COVID deaths rose from 4 a day to 51 a day within 5 weeks of starting their vaccination campaign. Similar scenarios repeated worldwide. The shots have a negative efficacy as they weaken the immune system. Slide 9, please. Question 3, are the COVID shots safe? Pfizer's FDA briefing document predicted more excess hospitalizations due to myocarditis as a result of the shots than the number they might prevent. Slide 10, please. UK data shows that COVID shots increase children's risk of death by 8,100% or more. US data shows we're killing 117 kids for every child we might save. Hospitals across America are overflowing with young patients with rare cancers, strokes, heart attacks, and unusual diseases as never before. Doctors and nurses are starting to speak up. Slide 17, please. How can you live with yourselves if we ignore 29,000 deaths after COVID injections on the CDC website and 49,000 reports of injury or death to children after COVID injection and keep saying safe and effective when you know they're not? Slide 19, please. I urge the members of the FDA to seize the moment and do what is right in God's eyes and what history will judge you favorably for, and not only reject the authorization of both Moderna and Pfizer for young children, but also revoke authorization for all the COVID shots which have killed and disabled so many Americans and human beings worldwide. I and millions of others pray to God that you will do what is morally right. Thank you.
Thank you for the opportunity. I have no conflict. I'm a 43-year-old researcher, biologist, and a mother. I'm here sharing my personal nightmare story after my Moderna injections. I was in very good health before my Moderna injection. I did suffer from seasonal allergies. I lived a normal, active life and happy life. I worked full-time, took care of my family, my farm, rescued dogs, and enjoyed multiple physical activities. I took my first Moderna injection early in March 2021. I took the injection because I believe it was needed to protect myself, my family, and others in my community. I believed it was safe, effective, and the right thing to do. After my first injection, I had an anaphylactic reaction, rash, tachycardia, dizziness, shortness of breath, intense gastro pains that lasted months. My doctors ignored my reactions from the first injection and unbelievably recommended a second shot. They said it was needed to be safe. I took the second Moderna injection in June of 2021. I got dizzy right away. 2 days after the injection, I could not get out of bed for a couple of days. My right leg and my arms were weak. I developed facial paralysis and migraines. My eyesight became fuzzy. I was dizzy and confused. I had no choice but to stay down. It has been about 12 and 15 months post-reaction to the injections. I still deal with daily fatigue, dizziness, memory problems, nerve and joint pains, burning of the skin, numbness, ringing of the ears, headaches, tingling sensations of my body. My face droops, and my right hand tremors. These injections have badly harmed my life, my family, my work, and my health. They have taken me away from everything that made my life happy and fulfilling. So far, there is no effective treatments that can help me. I have seen numerous specialists, try special diets, supplements. I have found no answers or guidance. There's no pathway of improvement. No one knows if I will ever get better. This makes me feel really helpless and hopeless sometimes. Since the injections, I have been diagnosed with dysautonomia, small fiber neuropathy, mast cell activations. I'm unable to do most basic tasks, including driving. The effects of these shots are so extreme and never-ending. As soon as I mention that the symptoms are vaccine-related, I feel completely ignored. Most doctors do not want to talk about the possibility of vaccine injury. How is that going to affect the little kids that cannot communicate or explain what's going on with their bodies? Side effects needs to be acknowledged publicly. Long-term research needs to be done before we can push this into our kids. Knowing the level of immunity before injecting this into our kids should be accounted for. Thank you.
Hi, everyone. I have no conflict. I do not want approval of this vaccine. I'm going to tell you my own story. I got the first injection on September 15th, 2021. Sorry, it's very emotional for me. I got the first dose and everything was fine until 8 o'clock on Friday morning at 8 o'clock. I woke up and my hands and my arms were completely numb and tingly. I called 911, but instead of going to the hospital, I went to my doctor's and did a urine sample and an EKG, and I was sent home. By Sunday night, I was just watching TV. I got up to go to the bathroom, and I said out loud that I was really dizzy. My husband said, we need to take your blood pressure, and he immediately he took my blood pressure, and he immediately called 911. It was 211 over 105. I took one of my husband's blood pressure pills because I was not on anything because I was a completely healthy person. And I also took 325 milligrams of aspirin. The paramedics confirmed my extremely high blood pressure, but since I took the pill, I decided to stay home. At 11:30, my husband said, let's take it one more time before going to sleep. And my blood pressure was even higher, so 911 was called again. I took another aspirin and a second pill for my husband. The ambulance came, they did an EKG, and they said my heart looked good, and COVID was rampant in the hospital, so I stayed home. The next morning I woke up, it was 198 over 98, so I went to the ER. I took a third pill of my husband's blood pressure medication. I was in and out of the emergency ERs and urgent cares Monday and Tuesday. By Wednesday, I went back to my doctor's and did another urine sample. He gave me a second blood pressure pill to take, so now I was on 2. By Thursday, my left arm had pain and numbness and was admitted into the ER. By Friday in the hospital, I got an email from my doctor that I had protein in my urine. In 5 days, it went from 0 to 433, and I now have permanent kidney damage. I released all my medical records to Moderna. Moderna called my doctor because I had 100% proof it was vaccine-related from the urine samples. They said that they're seeing many cases like mine and that I also had all my blood work taken 3 months earlier. My glucose was 82. I had no A1C problem. My blood pressure 10 days earlier in the doctor's office was 100/70. After the vaccine, my liver enzymes, glucose is now 125. I have high A1C. My Epstein-Barr virus was reactivated. My hands are still tingly and numb. And the worst part about it is I'm allergic to foods that I've never been allergic to. And I eat them, and my blood pressure goes to 200/100. And I would say that's crazy, except I don't know that I ate something that I was allergic to. Why on earth would you give this to kids and young people when the risk of dying from COVID is practically zero? How many people have to go to sleep and never wake up? It is not a coincidence. Kids are dying on the fields from heart conditions like never before. Me and thousands of lives are forever changed. We have no recourse. We can't go after the vaccine injury program. Moderna has complete immunity, and we're censored on our support groups. We have to talk in code. And I'm very concerned that, this is all about money, and I really don't know how people sleep at night knowing this is injuring and killing people all over the place. And I really want answered. I'll give you my Moderna case numbers. It's MOD 211-45534 on 9/20. The second one was MOD 211-58661 on 10/29. My third one is MOD-2021-369784 on 11/18. Thank you.
Hi, thank you for allowing me to speak. I have no financial conflicts. My name is Richard Erickson. I'm a technology executive, a business leader, an entrepreneur, a coach, a husband, a father of 4 amazing children, 20 down to 11 years of age. I've worked my career as a creator, thought leader, and supporter of a number of our large enterprises, coming up with visionary ideas and technology and help thousands of companies innovate and become more competitive and grow. I started and launched many companies, employed thousands of people, and helped grow our youth economy over the last 30 years. I've also been a competitive athlete, mountain biker, youth coach, and support our local community, giving back when I can. I was supportive of our vaccine mandate to help save lives and to get our economy back running again. As of April of 2021, I received my second Moderna vaccine, and within about 2 weeks, I immediately had temperature intolerance, tinnitus, and exercise intolerance with the disruption in my sleep schedule. Prior to this, by the way, I've had absolutely no underlying issues or conditions. I assumed all of this was due to stress and tried to kind of move on with my life last year, continuing to work and sitting on board seats as I had done previously. In late December of 2021, I received my third shot, my booster, and at that point I became seriously ill. I had an eruption of new symptoms that included bizarre nerve vibrations in my head, neck, body, debilitating headaches, chronic fatigue, sensitivity to light and sound, severe exercise intolerance, muscle spasms, and severe insomnia. I don't remember much in January and February of this year. I live in Minnesota. I was brought down to Mayo, had to take a leave of absence from my position in my executive board seats. In March, I went down to Mayo and had an extensive set of testing with a variety of findings, but no clear understanding of how to treat for an adverse event or even long COVID for that matter. I spent most of my time in March reaching out to research institutions, attempting to understand what had happened to me and determine how I could treat my symptoms. Unlike maybe some of the others that have had adverse reactions, I have not had any conversation or discussion with Moderna, or any other institutions regarding the adverse reaction. I would love to do that if they are able to help. I've met hundreds of people dealing with similar symptoms who are disabled, unable to work and contribute. Many of us have the same story or are limited to support from our local, or have no or limited support from our local medical systems and are searching for research that might help. My ask is, quite simply, is we need help to coordinate access to resources, directions for treatment, acknowledgement, and hope that we can recover. I've gone from a highly active person and contributor to our economy to someone who is now dealing with a chronic illness with no clear treatment path. My challenges every day are just simply doing the basics of life, not being able to go out and see my kids play soccer or join them at events that are remote. I'm struggling with just figuring out how to get my life back in order and get back to working on this economy, which is one of the things that I love to do. In conclusion, I really think we need a public-private partnership with those that are financially benefiting and should be contributing to help those who have adverse reactions. Despite my reaction to the vaccine, I still have support for the vaccine's mandate. My ask is, again, we need help that provides direction and support for those who have been affected and turn their lives around, or have had their lives turned upside down by Moderna and other vaccines. I also would ask for help for those that are being affected by long COVID. Thank you.
Thank you for having me on today. I have no conflicts of interest. My only interest, excuse me, is in saving children's lives. I pray that the advisory committee members will open your hearts to God's truth about protecting his children, which includes your children and grandchildren. I'm an MD, graduate of Tufts Medical School, one of the top 10 in the country. I am trained as an orthopedic surgeon. Before I went to medical school, I was a mechanical engineer, a systems and electrical engineer from Brooklyn Polytech, and a rocket scientist. In the late 60s, I had a machine shop, and we made parts for Grumman, who had the contract for the LEM, the Lunar Excursion Module, that landed on the moon in 1969 with Neil Armstrong and Buzz Aldrin. I myself machined the parts for the LEM that I held in my hand that are still sitting on the moon as we speak. So when I look up at the moon, it's a totally different experience than for most people. I'm appalled at the arrogance that you, meaning the FDA, have in even thinking about vaccinating healthy children with outdated, highly toxic COVID vaccines, children who have a 99.998% survival rate with no sequelae if they get COVID. Their statistics show that over 100,000 children ages birth to 18 that have been vaccinated with Pfizer, BioNTech, and Moderna's so-called vaccines have had severe, life-threatening adverse reactions such as myocarditis, Guillain-Barré, and many more severe adverse reactions, and even death. We know that VAERS is underreported by a factor of 100. The data cries out loudly to stop this insanity immediately before you kill or maim one more innocent child. These vaccines are not experimental. They are bioweapons designed to maim and kill. In a risk-benefit analysis, since children up to age 18 have a survival rate of 99.9 adverse reactions and virtually no deaths, why in the world would you want to try to improve on perfection by exposing them to significant chances of being permanently severely injured, or dead? The risk is infinite, and the benefits are non-existent, and the efficacy is extremely negative. Why do you want to mess with God's given perfect system? The best treatment you can do is to leave these children alone under God's care. And failing to do that, then your only purpose is to maim and kill. That clearly being the case, the FDA should change its name to the JMI, the Joseph Mengele Institute. It is not too late to repent and return to God and his Torah. If you want to experiment, do it on yourselves. Don't think that for 1 second that God is not aware of your very nefarious and murderous plans and actions. If you, heaven forbid, go through with mandating vaccines for innocently healthy children, you will burn in hell for eternity. Thank you for your time and for listening with open hearts.
Hi, I do not inspire conflict. On April 7, 2021, I was excited to get my Moderna vaccine. Like many people, I wanted to do my part to end the pandemic and keep people safe. 5 weeks later, I had my second dose on May 5th, 2021. I had flu-like symptoms for 3 days and then was fine, so I thought. On Saturday morning, June 5th, 2021, exactly 1 month later, I started to develop vertigo. By Monday afternoon, I had lost my vision in my one eye, developed slurred speech, lost motor skills, and developed immense brain fog. I went to the emergency room immediately. When I got there, everyone was sure I was having a stroke. But after 5 hours of testing, they found out this wasn't the case. I was released and referred to a neurologist. After many weeks of tests, the neurologist believes it was from the vaccine, that it is massive neuroinflammation, but doesn't know how to treat me. The only thing she offered me was good luck. Throughout the course of the next year, I saw a PCP, an ophthalmologist, a cardiologist, an endocrinologist, and a naturopath, all hypothesizing the same thing. I've been completely on my own without any proper medical care for over a year now. No one really knows what's going on with my body and my brain. Last summer, at its height, I had experienced Alzheimer-like symptoms, losing pockets of time, forgetting who I was and where I was. I am 36 years old. Other issues that still exist today include heart palpitations, constant migraine headaches, hand numbness, and extreme memory loss, just to name a few. It's been hard to do the most basic of tasks. Before the vaccine, I was completely healthy. Since my injury, I've had to quit my full-time job and instead work part-time, spending all my additional time researching science articles, natural remedies, and how to heal myself so I can function every day, all while accruing five-figure medical debt. I am not the collateral damage in the war against disease. I'm a human being who deserves proper medical care, proper compensation, and empathy. In the court of public opinion, I've been called a murderer, an anti-vaxxer, and delusional. And ironically, you are the ones that lie to the American people that vaccines are completely safe for the average person. You are offensive to actual science and medicine, lacking any type of curiosity of adverse events. I've met other vaccine injured along the way that are losing their homes, their life savings, in addition to their health. How do you sleep at night? You are a disgrace to humanity. You are narcissists cloaked in healers' clothing. The vaccine injured deserve proper medical care and financial compensation. That is the least of what you can do. One thing I know for sure is that there are only three things that are guaranteed to never fully stay hidden. The sun always rises, the moon comes out every night, and then there's the truth. And when the truth comes out, I pray God has mercy on your soul. Myself and millions others will never stop fighting and telling the truth. Our resilience is bigger than your cowardice. Only cowards would avoid accountability as innocent people suffer. Approving this for children without fully researching the adverse effects is nothing short of criminal, extremely wicked, and shockingly evil. Thank you for your time.